Welcome back to my channel. Today I am going to discuss about OET Listening Part B. In OET Listening Part B, you get total 6 questions. There are some tips and tricks in this session. If you practice these tips and tricks, definitely you can achieve 6 out of 6 in OET Listening Part B. Let's begin today's topic. In this question, the question will start from 25th. In this question, you will hear the context of this sentence. The context that means background information about the questions. Here, you hear an optometrist talking to a patient who is trying contact lenses for the first time. Okay, this is the context of the question. After that, you will get the question. What is the question here? What is the patient concerned about? Okay, here the two people are talking. One is optometrist, second is the patient. Okay, you have to listen the what the patient is concerned about. That is the keyword of the question. So you have to underline the keyword. You have to listen. You have to properly give concentration what the patient is concerned about, what the audio is talking about, what the patient is talking about his concern. Okay, that there you will get the answer. Okay, and what is the tips I am going to apply here? That is very important. Okay, so you will hear some of the words which is present in the options, that is the soreness or remove the lens. These are the uh, soreness in his eyes, remove the lens, or some blurred vision. These are the sentence, they are options, they are given the passage. Okay, in these options you will hear some of the words which is present in the options. Okay, see, if you hear any words which is present in the option, that won't be the answer. That is the tips. Okay, tips number 1. If you listen any words which is present in the option, that won't be the answer. Okay, now I am going to play the audio. You have to listen. What they are saying, and first you have to find out what will be your answer. Okay, what is your answer? Okay, I told you, if there is any words which is present in the option, that won't be the answer. You hear. Okay, so let's hear the audio.
Extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an optometrist talking to a patient who's trying contact lenses for the first time. Now read the question.
Now, you've had the lenses in for a few minutes. How are they feeling?
Not bad. I thought I'd feel them actually touching my eyes, that they'd be sore or prickly, but I can't feel much at all. My eyes do feel a bit watery though.
It's okay. You've just used too much solution. Now, in a few minutes, I'll get you to try taking them out and inserting them again by yourself.
I had no trouble taking them out earlier, but I'm not confident about putting them in. I worry I'll press too hard.
That's unlikely to happen.
Things look rather distorted though. I mean, I can't make out the letters on that chart.
Any of them?
Those lower down.
Let's give things another minute to settle down.
Okay, what are the words you heard? Soreness you heard. Okay, remove the lenses. Okay, but what is the answer here? If you hear any words which is present in, I told you, which is, if you hear any words which is present in the option, that won't be the answer. Okay, here the answer is blurred vision. What he said about blurred vision, I can't see the letters on the chart which is in the lower down. Okay, so that means patient is having blurred vision. That's why the option is the correct option is option number A. But they said about the soreness, remove the lens. But she said I can't any problem about taking the remove the lens. But he said like that. Okay. So what the point I am going to make it here, any words they are given in the options, if we hear in the audio that 98% that won't be the answer, we will with the answer will be in the complete paraphrased options of the paraphrased sentence of the option. Okay, so now what here said, I can't see the letters on the chart. Last portion he said like that. That means patient having some problem in the vision, that is blurred vision. Okay, the answer they are given the complete paraphrased sentence. So if you were to listen any word or sentence about blurred vision, we can't hear. Okay, so they won't say. Okay, they won't say the direct sentence, they won't say the direct words or sentence. Okay, so you have to be very careful. Okay, they will say some words present in the option, so you have to choose correctly. That won't be the answer. I am 100% sure you have to practice these techniques when we are doing OET listening part B session. Okay, and message me if you are getting the answers correctly. Please message me. These techniques are working. Okay, and we are going to do the next questions. Now we are going to do the next questions.
Question 26. You hear a nurse asking a colleague for help with a patient. Now read the question.
Here, what is the keyword of the question? Why does the nurse need help? Okay, why does the nurse need help? That is the question here. Okay, so you have to listen. Is there any words they are talking about? The nurse need help. Okay, so you have to properly focus. Okay, so most of the time listening test you will miss the questions or miss the answers. Why you are missing the questions and answers? You are not concentrating properly, you are just listening or just hearing. Hearing is different, concentration is different. You can hear so many things. Okay, you can hear so many sounds, but you, if you listen or if you concentrate more, you will concentrate only this one. Okay, not other. Okay, so in listening test you need more concentration and focus. Okay, we can apply tips and tricks, but apart from that the concentration is matter for your result. Okay, you need more concentration, so you have to practice. You have to practice yoga, you have to practice concentration, you have to do prayer. Okay, so you have to improve your concentration ability. That is one tips I would like to give you, my friends. Okay, if you don't concentrate properly, it will be very difficult to achieve good marks in OIT listening test. Okay, so listen this test and apply what I told you the previous method, and apply this technique. Definitely you will get the answer. And you listen the question first and option, and find out the answer and check if your answer is correct or not. Okay, apply the technique.
Kathy, could you help me with the patient in bed 103? The woman who had surgery 2 days ago.
Oh, yes, she's due for discharge today, isn't she? Does her pain relief need topping up again? I thought she wasn't very comfortable this morning.
Oh, she's on a reasonably low dose, but she's coping. She needs her chest drains removing, though, and she's got herself into a bit of a state.
Ah, well, that's a two-person job anyway, so I'll come with you. Has the consultant seen her? I know there was some concern yesterday about her condition and the level of the fluids draining into the bags.
Oh, he's cleared her for removal of them today, but I think some reassurance might be needed first.
Right. I might just check her analgesia and give her more before we go ahead.
Okay.
Okay, what are the words you hear? You hear the condition of the patient and the pain level. Okay, in the audio they said about the condition of the patient and the pain level. Did you hear any word about worried about or the procedure? Did you hear any audio they talked about the worried or procedure? No, but they said, okay, she is in a bitter state. Okay, it is a 2% job, so I will come with you. That means they are going to remove the chest drainage. So it is a 2% job. Patient is a bitter state. That means patient is worried. So so that the reason that they said the totally paraphrase the sentence or the options. Okay, we didn't hear any word about patient is worried about a procedure, but they said it is a bitter state. She's in a bitter state. That means patient is worried about the procedure. Patient is worried. So this is a 2% job. I will come with you. What is the question? Why does the nurse need help? So the answer is B. So in this audio, we hear the condition of the patient at the pain level. So maybe we will think like that. Maybe the option number C or E. A. Okay. So we listened. These are the words. Okay. So be careful if any words they said in the options. That won't be the answer. Okay. That won't be the answers. Next question.
Question 27. You hear a senior nurse talking about a new initiative that has been introduced on her ward. Now read the question.
Okay, what problem was intended to solve? What problem was intended to solve? That is the questions. Okay, some questions you need to focus more. Sometimes this technique won't apply in some questions. Okay, here you need to focus 4. Okay, so in this question you have to focus 4 and definitely you will get the answers. Okay.
One of our key priorities is improving communications between staff, patients, and patients' families. We recently introduced a scheme called Dear Doctor, which involves giving each patient a card where they can make a note of any questions or concerns that they themselves have. They can also talk to their families during visiting time, or even on the phone, and see if there's anything else they'd like to add. The cards are then collected and given to the doctor before the ward round. We're really pleased with the response. Patients used to say that they only thought of the things they felt they needed to discuss when it was too late, so the cards give them a better chance to bring up whatever's on their minds. In fact, it's been so successful that we're going to roll it out on all wards in the hospital.
Okay, you got the answer. So they didn't say anything about patient confusion over given information. They didn't any paraphrase sentence or anything about patient confusion over given by the doctor. But they said one word here. We are really blessed with the response. Okay, patient used to say the only things they felt they needed to say. They felt they needed to discuss when when it was too late. So that means before that patient not discussing all their concerns when meeting with the doctor. So this problem they are going to solve it. Okay, what problem was it intended to solve? So that is the indirectly they are saying patient not discussing all their concerns when meeting the doctor, but the way they said there in the passage, patient used to say the only thought of the things they felt they needed to discuss when it was too late. That is the word they said in the passage in the audio. So the correct answer is here C. Okay, are you getting my point? What they are giving the answers? Okay, this is the way you have to find out the answer. You need more practice. You need more practice in OIT listening test. Okay, maybe you will think OIT listening and reading is quite easy, but it is a wrong assumption. Okay, OIT listening and reading is very very difficult task of OIT test. So most of the students, they I know, okay, because I am taking online classes. Okay, their mentality is like that. Okay, I can do the practice. Okay, but it won't help you. Okay, you need consistent practice in OIT listening and reading. Okay, if you are not practicing properly, okay, if not practice, it will affect your result. Okay, please my friends, okay, you have to practice properly. Simple listening and finding out the answers is not a technique. Okay, you have to listen properly and you have to concentrate properly. You have to listen and check your answers, and if you are not, how many questions you did wrong, you have to go to the audio again and you have to check where you are lacking, why you didn't get the answers. Okay, like that you have to do the practice. Practice is matter for everything. Okay, it is a test, it is a list, it is a skill test. It is a skill test. Okay, so you need to listen properly, you have to concentrate. For concentration is the matter, you have to concentrate properly. Okay, you have to concentrate, you have to listen different accent. Then you can then you will gradually you will develop a skill of listening. Okay, skill is, if you practice listening test, definitely you can achieve good marking speaking test also. Speaking test. Okay, so in the listening test, you can definitely you can achieve speaking. What are the whatever sentence they are. This is a patient doctor interview or consultation. Okay, so you can catch some of the words they are talking. So definitely it will improve your listening as well as speaking. Okay. Next question. You hear two radiologists talking about the type of scan to be given a patient. Okay, the question is they agree to choose the method which will work. Okay, these the two people are agree to choose the method which will. That we have to find out. Okay, listen the audio.
Question 28. You hear two radiologists talking about the type of scan to be given to a patient. Now read the question.
I've just had a phone call from emergency. They have an 11-year-old boy with right lower quadrant abdominal pain. They're concerned about appendicitis and they'd like to order an abdominal CT for him.
Do you think that's a good idea?
I was thinking maybe we should recommend an abdominal ultrasound because then we can spare him the radiation.
Is there any concern in this case around using ultrasound instead of CT? Accuracy, for example.
The sensitivity is slightly less than the CT, but the specificity is almost the same, so I think we can rely on the results.
Okay. It means we can avoid the child being subject to contrast exposure as well. But what would we do if the ultrasound doesn't answer the question?
If we can't visualise the complete appendix, then we can recommend an abdominal CT.
Okay, we have a plan. Call them back and let them know.
Okay. What are the words you heard in the audio? Whole of the appendix. Okay. Research, they said about the research. So these are the two sentences we heard in the audio. Okay. Whole of the appendix also they said the accurate research, the specificity of the research they said in the audio. But if there are any words said in the fewest risk for the patient, but they say it means we can avoid the child being subject to contract exposure as well. That means there is a we have we it means we can avoid the child being subject to contact exposure. That means we have the fewest risk for the patient. So that's why that's the reason the option number C is the correct. But I told you the technique. Okay, if there are any words which we hear in the audio, which we hear in the audio, it is present in the option, that won't be the answer. So in the audio they said the whole of the appendix, they said the research about the research also they said, but they didn't any word about the first risk for the patient. But they said we can avoid child being subject to radiation exposure. Okay, contrast exposure, that means they are going to follow the low risk for the patient. Okay, so that's the reason C is the answer.
Question 29. You hear part of a surgical team's briefing. Now read the question.
The question is the male surgeon suggests that the patient could hear. Okay, what the male surgeon is suggesting. Okay, there you will get the answer. Okay, here is the two person audio. Okay, the what the male surgeon is suggesting about the patient, there you will get the answer. So you have to listen properly what he is saying, suggesting. Okay. Okay.
Okay, next is Mr. Malloy's repeat laparotomy. Any anaesthesia issues?
We don't expect any particular problems. He's relatively fit and well, except for his epilepsy, which is under good control. His BMI is 35.
But will we need the obesity bed?
It shouldn't be an issue.
And what about the epilepsy post-operative management?
He's taking his oral medications, and we can use an IV if necessary.
I know he was in a lot of discomfort after his last surgery, and this time he's going to need a larger midline incision. It may be worth thinking about an epidural. He's certainly at the extremely low edge in terms of pain threshold.
So you have you got the answer? Okay. What the male surgeon suggest about okay. He is going to need a large midline incision. Okay, it may worth thinking about an epidural. That means he said he is suggesting benefit from a specific anesthetic procedure. That means this time he need a large midline incision. So he need epidural. So what the surgeon suggesting about the benefit from a specific anesthetic procedure. So why option number A require specialist, why the answer is not a require specialist equipment during surgery? Why it is? Okay. The patient, they said that they will need an obesity bed. They said will need an obesity bed. It should be an issue. It shouldn't be an issue. So we can eliminate this option. But they said the epilepsy. They said about the epilepsy. It is under control. So because of that two reasons, these two options are not correct. So what the male surgeon is suggesting, what you have to listen what the point he said. Male surgeon. Okay, male surgeon, what the point he suggested, that there you will get the answer. Okay, then the last one.
Question 30. You hear a senior research associate talking about a proposal to introduce interprofessional primary healthcare teams. Now read the question.
We're looking at opportunities to improve the effectiveness of health and healthcare systems here in Canada. One of the interventions we're looking at is interprofessional primary care teams, groups of professionals working together collaboratively to provide services including healthcare, social services, and advice to patients within the primary care setting. There's evidence that teams like these can improve chronic disease outcomes, including diabetes, hypertension, and heart disease, as well as mental health problems. There's also evidence that improvements can be made in terms of both access to and coordination of care. Now, the extent to which these teams could affect the costs of healthcare in such areas isn't quite clear within the evidence, but the work we're doing aims to address such issues while looking at the challenges of implementation and evaluation.
Okay, then what is the answer here? They said about the collaboration, they said about the medical care. I thought if there are anywhere you hear in the audio, that won't be the answer. But they said, what is the question here? What is the keyword of the what hasn't been established about the teams yet? That is the question here. Okay, what the way they said they could affect the cost of the healthcare in such areas is not clear. It's not clear. That means the cost means the financial. See, the cost means the financial impact they are likely to have. That means that is not established yet. The cost of the cost of the healthcare in such areas not established yet. That is the way she said. That means they indirectly she said the synonyms of the paraphrased sentence of this option. So the keyword of the question is what hasn't been established. What hasn't been established. Okay. So you have to listen probably what it is not established in the audio, or what point they are talking about not established. Okay. So she said the cost of the healthcare system, cost of the area is not being it's not been not quite clear. Okay, that's the way she said in the audio. So because of that reason, the option number B is the correct. Okay. Mm. What are the tips I told you? Is there any words? Tips number 1. Is there any words you hear in the audio which is present in the option? That won't be the answer. Okay. First tip. Second one, you have to listen. You have to concentrate more. You need more concentration. Okay, you can hear so many words. Yeah, you have to concentrate, not a hearing. Okay, you have to practice concentration technique. Okay, second one, you need more practice. Listening is quite tricky. You need more practice, and you have to do more practice in listening test, and you have to check if there what you made mistake of this mistakes of the questions. Okay, you have to find out the answers. third one Third one is what I have to say. So third technique is I am going to the golden technique. Okay, if you listen, see in this audio, you missed almost, you didn't understand anything. Okay, so total three options, A, B, and 3. Total three options are here. Okay, total three options. Okay, so in the first 25th question, answer is A. 26th, the answer is B. Okay, 27, the answer is C. 28, the answer is C. 29, the answer is uh, B. Okay, 30, the answer is B. Okay, if you didn't if you missed almost all the questions, you didn't understand. Okay, then what you have to do, you can apply monkey technique. What is monkey technique? Either you write A, or options write A, or B, or C. If you write A, you will get 1 mark. Okay, you will get 1 mark. Okay, if you write B, only B, 6 questions you write only B, you will get 1, 2, 3, 3 mark. Okay, if you write A, you will get 1 mark. If you write B, you will get 3 mark. If you write C, you will get 2 mark. Okay, so if you are, this is the final technique. Okay, you but you didn't get any answer, but you listened all the audios. Okay, the audios played, but you missed all the questions. Okay, but what is the technique then you have to apply? This time you have to apply, either you write A, or B, or C. That time you will get definitely 2 mark. Definitely you will get 2 or 3 mark. Okay, practice this technique. Okay, it depends upon the luck also. Okay, so maybe you will get 3 marks, sometimes you will get 4 marks, sometimes you will get 1 mark. Okay, so get 0, better than getting 0 is, if you get 1 mark is okay, na? So practice this technique. Okay, in your OET listening, definitely you can achieve your desired score. Okay, thank you for watching my videos. I will come up with another session on next week. Please subscribe my channel and like the press the bell icon button. You will get the notification. Thank you. Today signing off, Sanita.